So this week was all about interprofessional education and how we implement that in with our students. Interprofessional education, it's really important as we grow as a profession, to not only kind of advocate for ourselves but also to learn from other professions. So as athletic trainers, and we're a lot newer, so we have to kind of show others what we do and how important it is for us, in some ways, so people can learn about what we do and stuff. So now there are a lot of ways that we can implement that. So I know in the perusal we kind of talked about what I did in undergrad, and I thought it was really helpful. So we would kind of meet in a big group of people, and it was our auditorium, so it was filled all the way with PTs, and it was like the first or second year PTs, and then senior ATs, nurses, respiratory therapists. We'd have actual people from the community come in, like EMTs, PAs, physical therapists, athletic trainers. I think we had the fire chiefs come in as well and kind of talk about what they do. So not only do you get an understanding of what each profession does, but you also can then speak in small groups about what specifically you guys do in that profession. So you're split up. I think I was the only athletic trainer. We had 2 PTs there, maybe a nursing and a respiratory therapist in my table. We first got to know each other and understand the professions a little bit more, because wasn't super sure about what respiratory therapists do, but then you talk to these people and you understand how valued and important their job is and why it's really necessary to have them. And then what was really cool is there's probably about 15 to 20 tables of people here, and initially you got a scenario that was put out to everyone, and each table got a specific part of the scenario that they were able to then talk about. So I don't remember what my part was, but it was closer to the end. So I think the treatment after they came back. So it was really cool to see that change from once they got injured on the field, the athletic trainer came over, and then moving more and more into EMT and the nurses. And, at some point, the nurses don't do anything on field management, but they could talk about what they would do in that scenario and who would kind of be in charge at that time. So that was kind of a cool, and then it moved into more of that hospital care, and then even we talked about after post rehab. So I remember I was lucky to be with PT students, since Dojo had a good PT program. They were kind of helping us there as well. So you kind of get a different perspective, because you had people that only from undergrad, but you also have people who kind of been to different schools first and then came to PT school. And so I think we had rehab, and so you're talking about different rehab protocols that we can implement for this injury, and it was really neat to hear their perspective as well as the athletic trainers, because they were asking us questions about, what do you guys actually do in the rehab setting? I'm like, well, we get this from, physicians or PT people, and then we use that, in our training facility or with the athletes. So I think not only did I learn a lot from the respiratory therapists and the nurses and the physicians about what they did in the hospital setting or a ER setting, but they were also able to learn from me as an athletic trainer or just athletic training student at the time, to kind of teach about what I do and why I love athletic training and how valued we are to the students. And it was kind of really neat, and I think it's really important not only for other professions to gain appreciation for what we do, but for us as athletic trainers to do the same, because especially with, like I said, respiratory therapy, I didn't have great appreciation for it because I really didn't know what they did. But even after this and talking to them and realizing, wow, that's actually really cool that what you guys do, and especially now during COVID, we hear a lot about them with the respiratory distress that you can get. So that was really cool, and I think, this is an integral part of the growing athletic training field, because as we get to understand more skills and more tasks, we're going to need help from more professions. A lot of the articles we read talked about the benefit it has also with patient care, and I think that should be our main goal when we're treating patients and athletes, is if, maybe I can't be the best person for you, but let me send you off to someone else, to do better. So if someone's wrist is broken, I can't, as an athletic, I can't x-ray that or figure it out. So I have to use someone else. And I think creating those relationships and understanding and value the people that you work with is an integral part of being an athletic trainer and performing the best for our patients. If I can think I can do everything, I don't need anyone else, then that's not only it's hurting athletic training as a whole because I'm stuck in my ways, but it's also could potentially be hurting that patient because they're not getting the best care they can. So I think it's really important for us to learn from other professions if we're able to, and also have them to learn from us. I don't know how it is at Kent if we're able to do something like that. Like I said, Jesuit's a lot smaller school, so we're able to super easily communicate with all the nursing professors, and I know one of the PT professors by name. So, but I know we always talk about how Kent's College of Nursing is very separate, and there's a big thing. So I think we're really cool to kind of actually work with nursing, since they're with their clinical hours and stuff, they're similar to athletic training. I think it'd be kind of cool to be able to learn from them and other professions within Kent. So if that were ever possible for the students, even for us, I think even as, certified athletic trainers, we always have more to learn and more to grow from. So I'm always ready to continue education, even, in the field. I'll keep learning. So that's all I got, but I think it's a really important concept. I think I really enjoy doing it. I wish we could implement it a little bit more in our undergrad program here. So that's what I got.